Good evening, everybody. I'd like to welcome you and thank you for joining us this evening for the second of our 4 webinars that the Down Syndrome Association of Minnesota has planned for 2017. We're very excited about this particular webinar this evening since toilet training are probably 2 words that can bring a lot of parents to their knees. And if you have a child with Down syndrome, there are other challenges that you really are overcoming on this journey. I had the pleasure of hearing Dr. Patel present at the NDSC convention last year, and I do have to admit that at some point during the presentation I did find myself thinking, where were you 30 years ago when I really needed you? Dr. Patel is an assistant professor of child and adolescent psychiatry at the University of Colorado School of Medicine. She practices at Children's Hospital in Colorado. She is also the director of psychology for the Anna and John J. C. Center for Down Syndrome, also located in Colorado. She provides consultation with schools, does parent training regarding the management of challenging or unsafe behaviors, evaluation for dual diagnoses, Down syndrome and autism, for instance, toilet training, and desensitization to medical devices such as hearing aids and CPAPs. She's worked with hundreds of individuals with Down syndrome from 1 to 25 years old, and outside of her clinical work, she has presented to numerous organizations across the country and internationally. She also conducts research on clinical issues impacting those with Down syndrome. And at this point, we're going to turn it over to Dr. Patel.
Hi, everyone. Thank you so much for spending the evening with me talking about toilet training. Definitely a very challenging topic, but honestly, I have to say it's one of the most fun parts of my job because we definitely feel like we're working together and then really seeing some very positive outcomes. So I'm really excited to talk to you guys about this today. So I don't have any financial disclosures, but as a part of my job, I think it's really helpful to kind of understand where the Anna and John J. C. Center for Down Syndrome is housed. So our clinic is actually at Children's Hospital, Colorado. We're a multidisciplinary clinic with medical docs, physical therapists, speech therapists, occupational therapists, social work, nursing, all kinds of folks who work together to see families for a multidisciplinary appointment to really better understand what services they're getting in the community and then how to really help take the next step when it comes to intervention. So I work full-time for this clinic, and we are affiliated with a few other programs. So Global Down Syndrome Foundation is our advocacy and outreach arm associated to the C-Center. The Cernic Institute for Down Syndrome is really the research side of things, also housed on our campus, but not at Children's Hospital, Colorado. We have an affiliation with Rocky Mountain Alzheimer's Disease Center, and then we are in the works for building an adult clinic very close nearby so that when all of my friends age out at 25, we can send them to another well-respected place of care. Today, as mentioned, we'll be talking about toilet training. To start off with, I am going to really kind of talk to you guys about readiness. You probably have seen lots of things online about when is my child ready to be toilet trained, and I really want to emphasize that just because our kids with Down syndrome haven't met all of those readiness skills, that doesn't mean you can't already start working on it. And so I'll go through some of those readiness skills and then what challenges children with Down syndrome particularly might have related to those specific readiness skills. The second thing I'm going to talk to you guys is a really step-by-step guide on getting started with toilet training. I feel like we a lot of times kind of hear 8 million different ways that toilet training can be successful. Some people say, throw underwear on them and they'll learn, or some people will say, sit them on the toilet for the weekend and eventually they'll go in the toilet and they'll get it. And I find a lot of those strategies, you know, may work for some children and really may not work for others. And so what I really hope to do is give you guys a strategic plan that is really well informed and individualized to your child to be able to say, you know what, we have a good plan moving forward and we know that we're making progress. The third piece that I want to talk about is troubleshooting areas of challenge for children with Down syndrome. So once we identify some of the challenges, then we're not going to say, oh, we're going to throw our hands up and we can't do anything about it. We're going to say, what are the things that we can do to modify and support our kids so that they can better understand what toilet training is all about, so that they can have adaptive equipment that, you know, might help support them physically, and really just being able to have the communication ability also to let you know that that's something that they need to do. So when you talk about toilet training readiness, like I said, there's so many different things that you will see come up. I actually pulled this from Baby Center, which is a pretty, you know, it has a lot of traffic as far as what readiness skills are considered to be necessary in order for a child to toilet train. So we categorize these into 3 different areas. First is medical and physical. So typically, when we talk about toilet training, we would expect that a child is coordinated enough to walk and even run steadily. Urinates a fair amount at one time. So, you know, when we think about infants, they kind of pee all the time. It's one of those things where you feel like, oh, I just changed their diaper and now I have to change it again. But part of the reason for that is because they actually haven't developed the physical ability to control the muscles that are a part of that stop-start process. So if your child is actually urinating a fair amount at one time, it really is indicative that they are moving in that direction. Has regular, well-formed bowel movements at relatively predictable times, has, quote, dry periods of at least 2 hours or during naps, which shows that they have the muscle development to hold the urine, like I mentioned earlier. The second area is behavioral. There's a lot of things in behavioral, which is what keeps me in business, I guess. So under behavioral, you really assume that a child is ready for toilet training when they can sit down quietly in one position for 2 to 5 minutes. They can pull their pants up and down. When, you know, for some kids, when they start acting like they don't like wearing a wet or a dirty diaper, or if they show interest in other people going to the bathroom. So these are our I kind of jokingly call them voyeurs. I have 2 children of my own, and I feel like I never have been able to go to the bathroom by myself since I had kids. So these are the kids who are curious and going, what are you doing? Let me see what you're doing. Gives a physical or verbal sign when they're having a bowel movement. So we think about grunting, squatting, telling you they're going. I would actually add on their hiding. So a lot of kids have their favorite spot that they go to when they are wanting to have a bowel movement, and will go to those spots when they need to. They demonstrate a desire for independence, so wanting to really do things on their own more often. Takes pride in their accomplishments. So just being proud of what they're doing. And so this doesn't mean just in relative to toilet training. It really means relative to kind of everything, you know, in their life. Is it resistant to learning to use the toilet? This one's going to be really, really important. I'm not saying that you cannot toilet train a child if they are really, really resistant to sitting on the toilet. It just means that we might have a slower process in developing the skills necessary to not be fearful of doing it, or not being so resistant that a child has a negative association to sitting on the potty. And is in a generally cooperative stage, not a negative or contrary one. The third area is cognition, so ability to kind of understand, for example. Underneath this is really understanding the physical signs that mean that they are ready to go and can tell that before it happens, or even being able to hold it in time for them to get to the potty. Sometimes, we know that kids, even without Down syndrome, go through a phase where they might have frequent accidents because they realize that they need to go, but it happens at a point where they are either not close enough to the potty and end up having an accident, or they start to go and then are able to hold it until they get to the potty. They can follow simple instructions such as go get the toy. So a single step direction is what that really means. Understands the value of putting things where they belong, and has words for urine and stool. As you can imagine, this is a lot. So when we talk about toilet training being a pretty complex process, it's not an easy thing to master, and there are a lot of subcomponents that go into it. For children with Down syndrome, there are actually some challenges or obstacles that really make it harder to get to a point of toilet training. I have some families who have had kids who've toilet trained between 2 and 3, and I have had a lot of families who have had kids who are much older when they're toilet trained, more in the 5 or 6 range. What research really shows is that there is wide variability, and that children with Down syndrome tend to potty train between like 4 and 7. That doesn't mean that that's always going to be the case, but that's kind of the average that they determined. So what are the challenges that children with Down syndrome encounter that make toilet training delayed or just a little bit more difficult to master? So going into those same categories, we're going to kind of go through what those the criteria for readiness are, and then what challenges our kids specifically have. So the first thing is that we know that our children have delays in motor control. So when we're talking about being able to run to the potty or being able to run smoothly, for a lot of our kiddos, that's a little bit more delayed. Gross motor skills tend to be a strength for a lot of our kids, but just being able to have more physical control and being able to move, switch directions and things like that, or even being able to actually hold yourself up on a toilet can be something that creates a little bit of that delay, which kind of leads into that second piece of low tone. So a lot of times, we don't think about the fact that it can be very scary to have to sit up on a adult-sized toilet, even if you have an insert in it, because of the lack of ability to really kind of control your body movements or to feel confident in that due to that low tone. A lot of our kiddos have constipation issues. It could be related to an anorectal malformation, so that just means like a malformation of the anal area that results in going poop hurting or really not working out as well. A common one is Hirschsprung's disease. Really typically it's not that it's super duper common, but if you are having challenges with stooling in particular, it is something to talk to your doctor about just to make sure that you rule it out. If you're not having issues and it's more that your child is just kind of having to break themselves of this idea of I can go in my diaper versus in a toilet, that's a different issue. Our kiddos tend to have chronic GI issues, so celiac is more common for children with Down syndrome, and a lot of times having particularities about what sensory issues around what foods they like to eat, which then result in bowel issues. So those things can also be challenging. Differences in stature can cause challenges with like independence on the toilet, so being able to reach the toilet seat or reach around to clean up. So those things can be difficult as well. Additionally, our kiddos have fine motor challenges. So when we talk about gross motor being like full body movements, we talk about fine motor being ability to kind of manipulate small things. And you can imagine how holding a piece of toilet paper, aiming in the right direction, all of that can really impact ability to be independent with toilet training, I should say. Again, that doesn't mean that you can't toilet train, it just means that it might take a little longer to develop that independence, or adaptive equipment might be necessary. When I mention this, I should also say these are not things that every single child experiences. All of our kids are very unique and different, and so it's super important to just think about what are all the factors that could potentially affect a child with Down syndrome and who is trying to toilet train, and then let's just kind of look at the ones that are unique to your specific child. The second area, behavioral. So our kids tend to have a delay in impulse control and attention span. This is not just because they don't like to sit, it's because the development of their brain has been interrupted in a way that it makes it harder for them to inhibit their impulses of doing things. So when we're talking about sitting on the toilet for 2 to 3 minutes, that might not be feasible right away for a child that we have or that we're working with. But again, that's going to be independent or different for every single child. The second one is motivation and lack of concern with soiled or wet diapers. This is, to me, one of the biggest challenges with toilet training. Again, this does not mean you can't toilet train your child. It just means that they will probably be on what we call a timed void, meaning like on a schedule to go potty. and toilet trained that way versus a child who is asking us to go and cognizant or aware of their body functioning and asking to go. And some of that is, just that a child doesn't, really understand the social implications of having a dirty diaper for an extended period of time, and just might not be, from a sensory standpoint, like experience it as distressing. The kids who do experience it as distressing are ones who, in my clinical experience, tend to toilet train a little more quickly. Demonstrating a desire for independence but related to their own interests. So as you guys probably recognize, we have a lot of kiddos who are super duper motivated by being independent, but it really may be around their own agenda or things that they're motivated by, and not necessarily toilet training. Toilet training is not only a complex thing, but it's also really difficult to explain why that's important. And I think that we rely on that a lot, but for our kids, sometimes that can be difficult to understand. We call our kids willful sometimes. So if we have a particularly willful child who has a strong opinion or a strong drive to do things a certain way, that can definitely impact things as well. Family readiness, breaking an old routine. This is actually one reason why I tell families to start the toilet training process or things related to toilet training early on. So as indicated before, I work with kids as young as 1 and as old as 25. And sometimes just breaking a child of the habit that they always have been going in their pull-up or diaper can be really difficult. And that's true for any child, but particularly true for some of our kids with Down syndrome who really, really thrive and love routine. And so changing that, or being able to say, hey, now we're going to do it differently, can sometimes invoke a little bit of anxiety because the child might not understand why it's different, and that can result in a delay in being able to toilet train as well. Again, we come up with pretty awesome strategies for breaking our kids of those routines, but it may just take a little bit longer. Family readiness related to prioritization. Our kids are so complex. They have a lot going on. A lot of times they have a lot of medical challenges going on. And I think it's really, really important to recognize that every parent is doing the best they can. And if you are being told, oh my gosh, you should have toilet trained by now, really kind of self-reflect and say, what has stood in the way of me doing that? Because I think that sometimes it's not something that you're motivated by or something that you think that is important. It's more because there are other things that just have had to take priority in that moment. So I think it's really important to kind of reflect on that and then really ask yourself the question, when do I think I'm going to be ready? Who are my support systems, and what plan do I need to put into place that feels feasible? Anxiety. So some of our kids are at a heightened level of anxiety at baseline. If you think about it, our kids are navigating the world with less information than the next. So whether it's that they're processing information more slowly, or if it's that the language that's being used is too complicated, or that people aren't speaking in a way that makes sense to our kids, that they're missing a lot of pieces of information around them, and so that can really cause a heightened level of anxiety. And I do sometimes think that with toilet training, that's half the battle, is just helping kids to understand that it's not something scary. A lot of times people will ask me if they should hold their child on the toilet. And again, not in a I'm going to restrain them and keep them on the toilet, but more so just should I kind of hug them or create some comfort for them to go. And what I will say is, if the child is showing signs of distress, it's probably not the right approach, because we want them to have a good relationship with the toilet, as silly as that sounds, but have a good relationship and not feel like it's something stressful. It really just needs to be, this is a new part of our routine. As I mentioned earlier, a lot of our kids have sensory issues, so something as simple as, whether the toilet seat is cold could be really, really adverse to some of our kids and create some resistance. Again, does not apply to every single child, but definitely can apply to some. The third area we mentioned earlier for readiness skills is cognition. So some of the challenges that children with Down syndrome might have is communication challenges with letting someone know that they need to go. You know, we can get, again, super creative on how kids can communicate to their family members when they need to go. And I think that we have to think beyond what the previous slide showed around verbal communication and having language around peeing and pooping, because a lot of our kids do beautifully with sign or assistive tech or even just a specific gesture that the family has become familiar with. So we have to kind of think creatively on how to address that. Lack of understanding about why toileting in the potty is important. So for a lot of our kids, I mentioned earlier that may not feel or understand the social implications of not being toilet trained, or it just may not make sense. It's kind of like the logical stance is, I've gone in my diaper or my pull-up for so long, so why are you trying to change what I do? So that can sometimes be a little bit of a hurdle as well. Kids with Down syndrome also oftentimes have a difficult time with generalizing skills from one environment to the other. As you'll see in kind of my step-by-step protocol, it is so critically important that we are making sure that everyone's on the same page with the toilet training process. That's actually going to increase or quicken the pace of toilet training when everyone's doing the same thing and the language that's even being used is the same. One thing I'll mention probably a little later in the slides too, but I'm going to mention right now because I'm thinking about it, is with regard to common languages, we don't ask kids, do you need to go potty? We say time to go potty, or we use something called a first then directive. So first potty and then something that's a preferred activity. Like I said, I'll talk more in depth about that, but I wanted to mention that even how you say it is really going to make a difference on behaviors surrounding toileting. So as you can kind of see, there's a lot of components that go into toilet training and kind of how effective we are at it. And for some kids, there's bigger obstacles to toilet training, and for other ones, there aren't. I know, I realized just now that this picture is kind of like a toilet. I didn't mean to do that, but apparently it still works. All right. So as I mentioned before, sorry, going back, we have to look at some of these things, and the handout that is attached will actually give you some specifics on how to kind of go through the step-by-step process. And I'm not sure why that says step 2, but the first step that we always look at once we have kind of identified what challenges might be occurring for a child that we might be trying to toilet train is that it's really important to track when pants are wet, dry, or soiled at 15-minute intervals for 3 consecutive days. The reason why I say this, as painful as that sounds, to check a child's diaper every 15 minutes for 3 days, is we could just place a child on a schedule, but we're going to have much more success if we actually understand what an individual child's natural bowel movements and urine, how long they can hold it is. So without this data, you can definitely still toilet train a child, but I will tell you that it's a little more difficult because it's also not going to tell you whether a child is ready or not. What I have families do is I send them this tracking sheet that that I have created, and I ask them to start when the child wakes up, so not at 5 a.m., but whenever their child wakes up, and all they're going to write down is whether their child is wet, whether they've pooped, or whether they're dry at 15-minute intervals for 3 days. Then the families typically send that information back to me, and it gives me the opportunity to look at it and say, on average, your child is able to hold it for about 90 minutes. And we kind of look at pooping and peeing as separately because typically the ability to be toilet trained with both doesn't happen at the same time. Urination usually comes first and pooping comes second. Although I definitely have heard lots of families who've said, yeah, we can catch the pooping much more easily so we can get them on the toilet more easily as well. But what I will say is that in my experience, at least catching them, there's more opportunities for urinating at least. So they'll send this back to me. I'll say, hey, this is about how long a child can hold it, and let's actually start taking them to the bathroom just a little bit short of that amount of time. So if they're holding it for 2 hours, we're going to actually take them every 90 minutes. or if they're holding it for 90 minutes, we might start out with taking them, every 75 minutes. But the idea is that with the amount of time that goes in between the times that they need to urinate, that's when you know that their bladder is full. So if you catch them at that point, it's much more likely that they're actually going to produce something in the toilet. And then from a cognitive standpoint, it starts to make more sense. So the more chances that we get and more success we have with going in the toilet, the more easily kids start to understand that that's where pee and poop go. So once we've kind of figured out how long a child can hold their urine, then the next step is creating a schedule for when to take the child to the bathroom based on that data. So I mentioned those time intervals to be just short of it. But, a lot of families feel like if their child is holding it for 2 hours, natural transitions are actually best. And the reason for that is because that's what we ultimately want kids to do, right? I mean, even when they're much older, we typically prompt kids to go potty before we get in the car, or potty when we get back home, or when we've transitioned into, an appointment or a building. Our hope is that kids will also tell us when they need to go, but initially we really want to prompt them a lot more in order to kind of keep them focused on it. A lot of times for children with Down syndrome, if they're doing something that they really, really enjoy, they may have a harder time with mentally transitioning to needing to go to the potty. So natural transitions kind of make it a little bit easier so you're not engaged in a power struggle. So the next step is to give a 3 to 4 week time span when you don't have any major events or vacations planned. This is that part I was saying about how we really kind of have to look at the family and really being able to toilet train when they're ready, and not just that somebody told them that they need to. So, I always say pick a time when there's like not major events or vacations, and part of that is just because this is an intense program, and if you are on vacation, you may have the best of intentions for staying on a schedule, but most often it's kind of impossible. So with not knowing where you're going to be. So I always say, pick a few weeks where you know that your routine is not going to be much different, and then really being able to commit to the program as a result of that. And then I have a note on here that remember that 3 to 4 weeks is not going to be the amount of time that every child is going to take to toilet train. It's actually much longer, but it's really to start getting them into the routine so that you're much more likely to stick to it later. So it's just as much, parent training as it is for the child. Step 4, identify the child, the family, and the system's strengths. I sometimes feel like we don't sit and do this enough. It's easy to kind of go, here are all the reasons or the barriers to toilet training, but we a lot of times don't identify what are our strengths and what are our child's strengths that we can really utilize as motivators for toilet training. So if I have a kiddo who really loves to be a helper, then I really utilize that as a way to motivate a child to go to the bathroom. You could really help me by going potty, or it's time to go potty. Can you help me, with opening the door, or something even simpler. But identifying that child's strengths can really, really be a strong motivator, and again, create and keep a very positive interaction. The second one with family, is everybody in agreement with the plan, or does somebody feel like it's too intense, or they feel like they can't follow through with it, or they feel like they're not going to remember when to take them. I mean, we can find all kinds of reasons why it makes it difficult, but we also can problem solve those if we know what they are. The third one is system strengths. So, if a child were just at home 24/7, we could kind of feel like, oh, we're the only ones who need to be doing this. But of course, our kids go to preschool and they go to, kindergarten, and we really need a school team that can also be on board with creating that consistency. Again, that does not mean you can't toilet train just because a school team is not on board, but let me tell you, it works way better when you have a school team that's also on board. Or even, systems means like grandparents, and when they're with care providers or daycares or any of those things, with having that same plan. part of the reason why I created the handout that's attached also is because it kind of goes through this process that I'm talking you through right now, but it's in one sheet so that you kind of end up with a clear plan at the end. And the hope is that when you have a clear plan at the end, then you can share that with other people who are going to be in charge of your child's care. So it is so critical to not feel anxious and overwhelmed by what challenges you might experience with this, but really to anticipate them and then to set yourself up for success. So I mentioned, what are all the things that make it difficult for children with Down syndrome to sometimes toilet train, a little more easily. And so, again, it's not about saying, oh, these are all the problems that my kiddo is going to have with toilet training. It's here are the challenges my child might have, and here are the strategies I'm going to proactively implement so that we don't have these issues come up. That's how we build on success. So, again, going back to those three categories, the first one is troubleshooting medical issues. Really, it is so important to address constipation. Even though it may not be intuitive or we may not think about it this way, constipation can actually impact urine production too. So a lot of times, I actually have a kiddo right now who had constipation before, no longer has constipation, but has become so anticipatory that it's going to hurt that this kiddo will actually hold urine as well as poop. And you can imagine how distressing that is, and then long-term, like how unhealthy that is too. So I always say address constipation on the front end because you might be surprised at how much that is actually impacting toilet training. All of these strategies are very much proactive. So to address it, you can talk to your primary care doctor. Some primary care doctors will actually send you to do something called a flat plate of the abdomen. It's just an x-ray of the belly, and it really helps them to see, is a child backed up with poop? Even if they're pooping regularly or pooping, every few days, a lot of times just having an x-ray can help you go, whoa, there's actually still a lot of stool in there, and we need to clean that out before we can start the toilet training process. Again, that's not true for every single child if they don't have major issues with pooping, but it's something to consider. So you might have to have a clean out if necessary, and proactive strategies for remaining constipation free. So sometimes that's related to use of constipation, medications that help prevent constipation, like Miralax. But it also can be something as just modifying the diet. So what are foods that typically make a child go a little more easily, and how can we, kind of increase fiber in their diet more often too, which again can sometimes be challenging for kids who have, a restricted diet. So the other thing that under the medical physical concerns is addressing physical challenges. So legs, these are kind of instructions I would give no matter what, whether your child has tone issues or whether they have stability issues or not. I always say that the legs should comfortably rest on a stool with the knees slightly above the hips. If you guys have ever heard of this thing called the squatty potty, it's kind of the most ridiculous, silly commercial I have ever seen, but it is actually holds a lot of truth. The way that your body is designed, when you have your knees slightly elevated above your hips, it's actually the ideal position for being able to poop without causing any stress for that process, or even just to be able to go more easily. I really hope you guys aren't eating dinner right now, because that would be a little horrifying with the things that I'm talking about. But being able to keep yourself comfortably rested on the stool with the knees above the hips. Clothing should be really easy to pull off and on. Again, from a motor perspective, there are so many cute clothes out there, but if you're trying to toilet train, it is not helpful to have things with snaps or things with zippers, really clothes that, with elastic bands or things that can be pulled on and off. If you have a child who actually is doing really, really well with zippers or buttons and it doesn't slow them down with getting on the potty, that's totally fine for them to be wearing those things, but something to, again, consider. whichever type of seat you use should provide confidence in stability. Sometimes people will ask me, do I use a potty that goes on the floor, or do I use a potty that, is an insert on a regular toilet? And I really don't have a preference unless there is a specific behavioral reason why we would want to do something differently. So if we have I have some kids who, if they have a potty that's on the floor, they'll only be able to sit for like 30 seconds and then they'll get up. Whereas if they're on a potty that's, an insert onto a regular toilet seat, they might sit for a little bit longer. As long as it's not distressing for them, I would say in that situation to have them sit on the potty that's an insert on the regular toilet. But other than that, it's really just more important to have confidence in their stability. Flushable wipes can oftentimes be more helpful than toilet paper. Some of that is because it's easier to kind of clean the area if you have shorter arms and you can't kind of reach out around fully. Again, to me, that's kind of a later skill to develop, because a lot of times we're in the bathroom helping our kids anyway. So it's just another idea for supporting independence. Here are just a couple of different types of potties and things that I take into consideration. So the next column, if you remember, was behaviors. How do we troubleshoot behaviors? You have all these really nice pictures, but I'm going to explain what they actually have to do with. So the first thing is addressing impulse control and attention. Important to be able to do that using ways to quantify time. One of the things that's really difficult for our kids to understand is how long something is or how much time has passed. And that's actually true for really, really young children as well. But for our kids, because time is such an abstract concept, it can be much more difficult to get to a point where they understand what that means. And so it doesn't mean, again, we kind of go, oh, well, they're never going to understand what I'm talking about for how long they have to sit. It's more being able to present it visually, which is a strength for our kids, and then using that visual strength to actually be able to help them understand how long they need to sit. So if your kiddo is only typically able to sit for 1 minute, you might use one of these little sand timers at a 1 minute interval so they can see how long they have to sit before they get up. A lot of times the reason visuals can also be really helpful is because a lot of times kids don't know how much time that is. They just get into the routine of understanding that when the sand is gone, then that means that I can get up. So sometimes you can actually stretch out how long a child can sit just by using that visual, even if the amount of time that the timer reflects is longer than that. So you see the little, on the left-hand side, the little timer with the red that goes away. That's actually a very common visual timer to use. The red goes away as the time passes, but you could also do the same thing with increasing how long a child will sit. I really feel like if you haven't produced something, if you're not actively stopping yourself from going, if you haven't produced something in 2 or 3 minutes, it really is probably not going to happen, or it's probably that your body's not really needing to go. Again, there is variability where it's longer for some children, but I would say that for a lot of kids and even adults, it's not much longer than that. So I would really refrain kind of doing the sit for as long as possible. The timer on the top, the little kitchen timer, so for some kids, just the audible sound works and they just kind of sit and wait and listen for it. For some kids, it doesn't. So again, you really have to take a developmental approach and see what works best for your child. Placing toilet paper and other distractors out of reach or removing them. I have so many kiddos who love to throw toilet paper down the toilet, whether they've actually gone or not. It's kind of a fun activity. And so what I would say is that, you know, part of the reward of going to the bathroom or going potty is being able to kind of make it a big deal that they get to put toilet paper in the toilet and flush, because that's a lot of times a big motivator too. Or they get to wash their hands after that. So a lot of times I'll say, even when you are in the early stages of toilet training, it is so important to still go through the same routine or motions that you would if your child were fully toilet trained. So like I said, hand washing, flushing, wiping, all to their developmental ability. So if you wipe, then you let them throw it in the toilet where appropriate. Utilizing a motivating book or toy that your child only gets to have within the context of toilet training. Choices work even better. a lot of times people will say, I sit my child on the toilet with a book or with the iPad, and they'll sit forever, but they won't produce anything. There's a reason for that. It is very difficult to teach a child what it is they're supposed to be doing when they have the motivator already in their hands. So, you know, if somebody gave me an iPad and said, you have to sit here until you produce something, I might actually even more actively stop myself from going just so that I can have that motivator for a longer period of time. So I really, really love using motivators that are only given in the context of toilet training, but after they've gone or after they've sat, whatever stage that you're at. Because a lot of kids are not going to always produce something, but if they're in the earlier stages, we just want to get them used to sitting on the toilet. And if they produce something, great, and if they don't, then that's okay too. It's really going to be, again, dependent on where they are developmentally in the toilet training process. Choices work really great in saying, what do you want to work for? Because kids like to be in charge, and having a choice means that you are much more in charge than if someone's telling you, here's your reward. Again, troubleshooting behavior or addressing some additional components of behavior is addressing motivation. So I mentioned earlier that you can use something called the first-then directive. Many of you have probably heard of it or heard somebody using it. The reason I really like first-then directives is that it's the smallest piece of information that tells a child what they need to do in order to move on to something that they prefer. So a lot of times lengthy explanations, remember how I said earlier that our kids sometimes process information a little more slowly? So the more the information and words that you use, the more difficult it is for our kids to actually pick out what the most salient or relevant pieces of information are. So first then gives you, first do this, and then this is what happens afterwards. So having them reward for sitting on the toilet, then producing something, and eventually asking them to go. This is only if you're really starting from scratch. So they get the reward just for sitting on the toilet. Yay! Here you go. Here's the then part. And then, like I said, moving up to actually producing something once you feel like they're getting consistent with that. The data that I told you guys that you would need to collect at the beginning helps you to at least still be more successful with catching them when their bladder is full, which would create more opportunities for actually producing something in the toilet. As the slide says, the reward must be something that can't be earned any other time. Otherwise, it just loses its motivation. So you see on the bottom left a first-then directive, which is visuals. Again, our kids have a strength in visuals, visual information, versus auditory, where kids may forget or they may get distracted. So a visual of first then for what they need to do, like the toilet, and then what they get to do is great. If you have to take them away from a preferred activity that they're already doing, that sometimes can be a challenge. But again, you can use the first then directive to just say, first we're going to go potty, and then you can come back and play. If the child resists moving, we put our hand on the toy that they're playing with and restate the first then directive. So instead of battling with them and saying, no, we have to go, or physically picking them up, to me that's kind of a last resort thing, because we don't want to teach kids that you have to physically move them when they're having a challenging behavior. But putting your hand on the object that they're playing with so that they understand you can't keep playing until you first go potty. You'll see on the bottom side, it's actually a roadmap. We've used this with some kids who kind of need to understand, like, what will happen if they have an accident and what will happen if they don't have an accident. This kiddo in particular was actually fully toilet trained during the day, and the family really felt like she had the capability of being toilet trained at night, knew how to get up and go, all of that, but just wasn't motivated enough. And so one of the things she was super motivated by was having her dad walk her to the bus. And so we created a visual to just indicate, like, if you have an accident, then dad's not going to walk you to the bus, mom will, and if you have a dry diaper or a dry pull-up, then daddy gets to walk you to the bus. And again, it was just to create some additional motivation for her. If a child is, I mentioned this already, so just helping them to understand that they can come back to a toy or a game. A lot of times for our kids, when we're asking them to transition away from something that is highly preferred, as crazy as it sounds, for a lot of your kids, they're thinking, I'm never going to be able to do this again. And so the behaviors that you see are much more reflective of that than, oh, you can always go back. So it is important to remind them that they can go back to the activity if they follow through with the direction for going to potty first. And then I mentioned the roadmap. So additional pieces on addressing behaviors. So I mentioned if a child has an old routine, we really have to help them establish a new routine around when they go. For those of you guys who use visual schedules or have heard or been encouraged to use visual schedules, toilet training is a great, enhanced by having a schedule. So if normally, they don't want to sit on the potty, sometimes if they're really familiar with a schedule and now the schedule has an added, icon that says going to the bathroom, it doesn't mean that they're not going to resist, but it sometimes helps them to just go, it's not so scary, it's not so bad, and I can move on to something more preferred afterwards. Keeping the times for toileting the same is really important, again, to establish that routine and to break the old routine and create a new one. For some people, they use something called the potty watch. You'll see a picture of it in the bottom left. It just beeps when the time interval that you've predetermined goes off. Some families love it. Some families hate it. The families that have trouble with it are the ones who feel like, okay, so the time interval resets after it goes off and you push the button, but then what if it's during nap time, or what if it's, during a time when they can't like drop everything and go. And so what I will tell you is the way that I use a potty watch is just to help move away from an adult prompting a child to the watch prompting a child. So the kids, when I was saying some kids will stay on a timed schedule for a while, those are the kids who might really benefit from a potty watch because then it's once removed. So no matter who they're with, they know that when the potty watch goes off, they need to go. Gradual changes is much better than abrupt changes. So, just how frequently you're taking them. You might have to start off with just 1 or 2 times a day if they are a child that's particularly rigid about following an old routine, and then you might have to gradually incorporate more and more opportunities to sit. For some kids, we've actually even done this trick where you basically cut a hole in a diaper if they are very rigid about actually keeping their pull-up on because they only feel comfortable going in their pull-up, then we'll kind of cut a hole in the bottom and the hole gets bigger and bigger and bigger and bigger, and eventually they're still wearing the pull-up but sitting on the toilet. And as the hole gets bigger, it's much more likely that they're going to produce something in the toilet. Again, that's not something that I would say we typically have to do. It's really more when we have a kiddo who's having a particular challenge. Giving minimal attention during cleanup routines. When we think about infants and they're on the changing table, that's usually an opportunity for us to have kind of a social interaction and really kind of make it fun and play games or make funny sounds with them or blow raspberries on their belly. And so as kids get older, they kind of learn that that's a really nice time for sociability. And what we know about many children with Down syndrome is they really, really love that social interaction. So it doesn't mean you have to be like, kind of ignoring the child. It just means that we kind of have to downplay how fun it is so that there's not motivation to continue having diaper changes, that there's more motivation around the excitement of having gone in the potty. As developmentally appropriate, have the child participate in cleanup. So, it's easy to keep going poop in your pull-up if there's no natural consequence of that. And so I'm not saying if you have a 2 or 3 year old they should have to wipe the poop and clean up the mess and everything, but if they're able to pull their pull-up off or throw it in the trash can or flush or do any of those things, it is really, really important to incorporate them as part of that cleanup process. Addressing parental readiness. So asking yourself, why am I doing this now? What is my motivation? Do I have the time to give this my full attention? Which I don't know that we ever fully have the time to give something our full attention, but I think that, just feeling like that's much more of our motivation is being able to say, I have the time now, I don't have as many stressors. Generally, how do I approach teaching new skills to my child? Do I get nervous even before starting, or am I somebody who's pretty calm? You will be amazed at how children with Down syndrome pick up on the cues of their parents or caregivers. So if I'm like, oh great, now I have to do toilet training, are they going to go or are they not going to go? If we're, like hesitating in that way, they're going to feel that, and then they're going to be responding to the anxiety that they're perceiving because they're so visual and watching our body language and our facial expression that they're not going to necessarily hear us saying, it's not scary, it's okay. They're just going to be responding to what they see. How will I handle obstacles along the way? So part of why I created, again, that troubleshooting or being able to go through the troubleshooting with you guys is because it's super important to be able to handle those obstacles, along the way without, in a proactive way as much as possible. If you have a good game plan from the beginning, then you are going to be less stressed and less likely to kind of come across these obstacles. But if you do have an obstacle, the question I really want you to ask yourself is, what is the function of that behavior? Like, why is my child doing that? So if they are, if it's a child who typically is pretty compliant and follows directions, but every time you try to take them potty, they freak out and they can't even sit on the potty, instead of going, okay, they're not ready for toilet training, the question you should ask yourself is, what's motivating that behavior? What is it that I think out of that whole slew of things that, Dr. Patel suggested, what, out of that list, what am I thinking might be motivating it? And if it's not something from the list, like what do I know about my child that might be motivating that behavior? Understanding why a behavior occurs empowers you to be able to come up with a solution that's going to be much more effective than feeling defeated by it. So, if I know my child likes the attention that they get from not sitting on the potty, right? So they like the attention, positive or negative, but still attention. They like the attention that they get from the resistance of it, then do I need to walk away and say, come join me when you're ready? And a lot of times that will be super effective if the function of the behavior is correct. So if the reason why it's happening is correct, then your strategy will work. If the reason why the behavior is happening is incorrect or you guessed wrong, then the strategy won't work. And so then you kind of have to go back to the drawing board. Troubleshooting behavior when it comes to anxiety. So keeping things in a predictable routine, whether it's related to toilet training or not, really, really helps reduce anxiety a ton. Using the same language each time, so helping kids to understand what it is that, that you're asking them to do every single time is super important to reducing that anxiety. This one I can't emphasize enough. Don't push your child to do a step they're not ready for. There's no prize besides not having to change diapers, but there's no big prize that somebody else gives you if you get to the finish line sooner than the next person. And so what I will tell you is if you create a negative association with the toilet or with the toilet training process, it is going to be a million times more difficult to break a child of that fear or that distress than it is to kind of take it into small steps on the front end. And I think that that's part of why I'm, people will ask me, and I'm sure some of the folks listening will ask, why I'm so against the weekend warrior version of toilet training, because I really think that it creates that negative association, and I don't want to then forever have to tell a child it's time to go potty and for them to feel fearful about it. It really should be a process of just, this is a part of my day and this is how I incorporate it. I don't think this is on here. I'm going to actually go back for a second. But this is one thing I would also ask folks to remember is don't introduce multiple new skill set development at the same time. So it doesn't mean you have to stop, speech therapy and physical therapy and occupational therapy and all therapies. It doesn't mean you have to stop those things. I would just say don't introduce something that's really challenging and new during that toilet training, the initial phase of toilet training. And again, that's just because our kids are working super duper hard, and if you introduce that, we're not going to know where their resources are going to go, and we want to really kind of help them channel it to toilet training. Giving choice. Control is an underlying function of anxiety. So when I was saying like understanding why a behavior is happening, a lot of times it is control. It's about wanting to be in charge. It's about being able to dictate what's going to happen next. And giving choices is a great way to do that. When I say choices, it does not mean it's two options that are, exactly what the child wants. It's basically still getting to the end outcome that I want, but really giving a choice between, in two ways to do it. So sometimes it's, do you want to sit on the potty in this room, or do you want to sit on the potty here? Or do you want to get up on the potty by yourself, or do you need help? Or do you want to flush, or do you want me to flush? All of those, like, as crazy as it can sound, those little things can make a huge difference for a child who really is anxious and in need of control in that situation. So we build on those things so that kids don't do naughty behaviors in order to assert control in ways that are not appropriate. Slow and steady wins the race. I said it before. There's no race to the finish. So really recognize and read where your child is and what they need in that moment. So the third area, so more troubleshooting, as if we didn't have enough already, addressing sensory issues. Not that everybody does this, but wow, a lot of times bathrooms are super loud, and a lot of times bathrooms have automatic flushers, and a lot of times home toilets have, a seat that is not comfortable. And so we have to kind of take all those things into consideration from a sensory standpoint. So we would really make sure that the bathroom is pretty quiet. And again, obviously in public places you have to kind of accommodate, but at home, like really kind of keeping it as a calm, quiet place. A little trick on the right-hand side of the screen, you'll see a little sticky note to cover up the sensor in public bathrooms. Automatic flushing is a little traumatizing for people. So it's not that you have to avoid going to the bathroom, but before your child comes into the stall with you, just having like a little itty-bitty pad of sticky notes in your purse or in your pocket and just covering the sensor so that it doesn't automatically flush when your child tries to sit down. Kids with Down syndrome have an incredible memory when it comes to emotional things that have high emotions or things that have been particularly stressful. So that child will bring up the fact that the toilet flushed and it was loud for years and years and years to come. And you can imagine how difficult that would be to then undo that. So I always say, again, proactive, proactive, proactive. You may have to modify the seat at home to, be like a cushion seat doesn't get as cold, for example. Air fresheners are also, or potpourri are also things that can be really distressing. Wipes can be good or bad. So some kids, wipes can be great, like I mentioned earlier, for cleanliness. For some kids who have sensory issues, they don't like the idea of that wet feeling, and so it might not be an appropriate choice, or we might have to have, follow the wet wipe with something that's dry. Troubleshooting the cognitive piece, so addressing communication. One thing to address communication for the receptive piece or the understanding piece is using a visual schedule to create a routine. So photos are best. When we think about communication, we think about, behaviors kind of being the most primitive way that we communicate. Like if you think about a baby, they don't talk or tell us what they need. They show us with their behaviors. And then we, go into making sounds or making signs. And then we talk about single words. Then we talk about phrases. Then we talk about sentences. So it kind of progresses in that way. And so if we think about from a visual standpoint, it's similar to that as well. You may have seen something called board maker icons. They're like little drawings of toilets and things that are related to a schedule. For some of our younger kids, that's really too abstract for them, and they really need pictures or photos of things to put on the schedule. So it's really important to kind of make sure we are meeting children where their developmental level is. Otherwise, the schedule is pointless because they won't understand it anyway. When you say it's time to go to the potty, it's really helpful to sign potty to help create an association, either sign potty or say potty. So for some of our kiddos who haven't developed verbal speech, signing potty or an approximation can be really helpful in helping them just to understand what they are going to do. The hope is that if they see you signing potty when you're taking them potty, then once they start to develop the ability to recognize they need to go, that they'll be more apt to use that sign because they cognitively understand the association. We mentioned first then directives, so start using first then directives in general. You will be amazed at how well you can get a child to follow your directions when you give it to them in a first then directive. So the first thing is the thing that they don't want to do, and the then thing is the more enjoyable thing that's coming after. And remember, the then thing doesn't have to be something that's, you know, monetary or tangible. So it doesn't have to be like, I'm going to give you a cookie or a piece of candy. It really can be something as simple as first potty, then read books, or first potty, then go play outside. Whatever you naturally were going to do, but you're just highlighting that piece as, you know, this part that you don't want to do is going to be over and there's something better coming after. Addressing comprehension. I don't know how many folks have heard of a social story, but it's basically a story that helps the child understand, you know, at their language level, what needs to happen. So we have some social stories that, you know, kind of say, my name is so-and-so, and I'm a big boy. I can do things that big kids do. Now that I'm big, I'm learning to wear big kid underwear even at night. So basically, it's a story that, you know, is in the first person perspective. It's always positive, so we're not telling kids what they shouldn't do. We're telling kids what to do. This is particularly important for kids with Down syndrome because they have a really hard time with coming up with the alternative of a behavior. So if you say, stop touching or don't touch, kids will continue. A lot of times, people tell me this, kids will keep touching. And then parents or caregivers get frustrated because they're like, why aren't they stopping what I told them to stop doing? It's not because they're being defiant, it's because they don't know what the alternative is. So a lot of times I'll teach families, instead of saying don't touch, it might be hands to your side or hands in your lap, or being much more directive about what you want them to do. So a social story is similar to that in that it's instructional, but from the first person perspective. So it's going to say, I'm going to do this, and I'm going to, if I feel scared or nervous, these are the things I can do to make myself feel better. So that's kind of the context of a social story. They were originally created by a woman named Carol Gray, who worked heavily with kids with autism, and it was a way of helping kids understand social situations. But I will tell you, I find them super helpful for our kiddos in explaining a lot of different things, not just toileting. Recognizing when they are urinating or having a bowel movement so they start to make the connection. So being able to even identify what it is that happens. So, oh, you're feeling a cramp in your belly, you must need to go poop, or you feel like you're tightening up your muscles. And obviously, again, using developmentally appropriate language. Teach by example, although like I stated earlier, it's a little bit disturbing that I can't have privacy when I'm going to the bathroom. I will tell you that teaching by example is a great way to teach kids the association of what they need to be doing in the toilet. So allowing kids to watch you and allowing them to watch you, you know, as you narrate it too. So I'm going pee-pee in the potty. Yay! Oh, now I'm going to wipe, and now I'm going to flush. So it's not just about using language, which might be really difficult for our kids to understand, but using the visual and the model of ourselves doing it to help kids to understand that better. So I mentioned earlier that one of the cognitive challenges is generalization of skills. So it's important to use similar tools in all settings, whether that means like using a visual that is consistent. When we were talking about that first go potty, then fill in the blank. We can even put a piece of Velcro on the then so that no matter where they go, the motivator can change, you know, to fit the setting, but that we're still using the same visual. Helping others understand the importance of the routine. So, you know, really, again, consistency across settings is so critical, and helping people understand that it's not that you're trying to make more work for them, but that in order for this child to learn, that it applies in all settings. We have to be able to do that skill in all settings. I mentioned using the same language. I had a kiddo who was having incredible success with toileting at home, but at school was having a little bit of a challenge. And part of what we learned, because we kind of tease apart that, and that's, you know, part of what my job is to understand what the additional challenges are, is that at home, when this little girl would pee, she would pee a little bit and then stop, her urine stream, and mom would say, make more pee-pee, and then she would finish, and empty her bladder. At school, she was having tons of accidents because they weren't using the same language. She would make a little bit of pee, and they'd say, good job, and she'd move on, and then she'd have an accident. So, so important that those tiny little nuances can really have a more significant impact than we would anticipate. Step 6 is trying it out. So now you have this well laid out plan, and the next thing is just to say, all right, I have a plan, I'm going to start executing it. Some quick tips, and I see that we're going to actually have a wonderful amount of time for questions. Some quick tips is that having your child sit for 2 to 4 minutes. So anything more than that, I really feel like you're going to lose their interest. They're not going to understand what they're having to do or why they're having to do it, and that's going to result in making it much more difficult to create that association. If your child cannot tolerate sitting that long, start out with smaller increments of time and build up. So remember how I was telling you that for many of our children, they don't know that the different sand timers have different amounts of time. We just teach them that when the sand is gone, then that means that we're all done. So basically, the way that you would do it is you would, and this works for toothbrushing, for eating, for schoolwork, any of those things. So when you turn it over, or even teaching kids how to wait. So you flip it over and you point out or have them look at the fact that the sand is going, and then you say, oh, a little bit more, and then the second that the sand is all the way to the bottom, then you say, oh, all done, okay, let's get off of the potty. And so the idea again is that you're helping them to understand the association. Once they understand that association, you can gradually increase the amount of time that they're sitting just by changing the timer to a higher increment of time, because now what they know is the concrete step of when the sand is gone, then my time is up. Rewards should be given after toileting so as not to create a distraction. Toilet is only for going potty. This is such a huge challenge. I feel like I encounter a lot of situations where the motivator is used while the child is on the potty, and I think people have been told that that's the way to get kids to sit on the potty. I have found that it actually works against toilet training in that the kids don't understand that what the potty is for. It might as well just be a chair in the middle of the living room for all our child knows. And so unless they produce something in that moment, they're not going to know to produce it, and if they really don't need to go, they're just going to sit there for the duration of the time while they have their preferred activity. So super duper important to help kids to be motivated by getting a reward after they go toilet to the bathroom, but that it has to come after. If your child has an accident, it's so important to minimize eye contact, minimize talking and facial expressions during cleanup. So I mentioned that whole creating a disconnect from the social piece of toileting and how important that is. And so it's not about being mean or disconnected from our child. It's more about kind of keeping cleanup as very matter of fact and as just something we have to do, and then moving on after that. Have your child participate in cleanup when developmentally appropriate. I mentioned earlier that we're not going to ask kids to kind of clean up a whole mess, but where appropriate, it is important to have them participate. And then finally, the best piece of advice besides consistency that I could give you is slow and steady wins the race. It really is about meeting your child where they are at, especially behaviorally and cognitively, and really being able to anticipate what challenges there might be, and then being able to really support them in that. some of the frequently asked questions, I imagine some of you might have these questions, so I thought I would just add a slide to answer them proactively. One of the questions is, should I only worry about toileting when all of the readiness skills are in place and the challenges have resolved? My answer previously and my answer now is no. Think about what you can start doing, whether it's introducing them to the potty, whether it's getting them comfortable with sitting, whether it's letting them watch when you go. But really, there are so many steps that come before a child actually has to be fully toilet trained that knowing your child, you can really come up with what can you already be introducing to help them not get into their old routine so intensely that they can't move forward with it. Should I put my child in underwear? This is a super complicated question, but I'm going to answer it, and I'm going to tell you that it is also going to be dependent on what your specific child's issue or challenge is. But I will tell you that more generally speaking, for families who tell me, I've been told just put them in underwear and they will eventually learn, I find that is actually very challenging, because if you happen to have a child who doesn't really care about being wet or soiled, it's just going to be much more difficult for the adults to sustain the toilet training process, and it's not actually going to do the job that it was intended to do, which is to deter kids from going in their underwear. So the reason that idea came up, was brought up, was because we thought, oh, well, if they go in their underwear and they feel distressed by it, then they'll stop doing it. But again, if you have a child who doesn't really care, I have lots of kids who, if they pee and poop in their pull-up and aren't really motivated for toilet training, they'll do the same in their underwear. So I always say it has to be strategic and it has to be for the right reasons. Typically, when I'm doing intensive toilet training with families, if a child has been pretty consistently dry and clean for 2 weeks or so with very rare accidents, I will say, okay, let's try underwear. But again, it's a very strategic move and not something that we use as kind of our initial approach. How long is this going to take? Unfortunately, I don't have a clear answer for that. And part of the reason is because every kid is so different. I will tell you that if you are very planful and proactive, it's going to go much more quickly because you're constantly anticipating what the challenges might be and you're actually resolving those challenges before they come up. So it's going to go much more quickly if you do it that way than if you are kind of like, well, we're just going to start taking them and see how it goes. That's what I would tell you, is being strategic helps. What do I do if my child is chronically constipated? We mentioned that it is really important to kind of address that, especially during toilet training, because it can definitely impact whether a child feels motivated to go or not. Should the reward be during or after toileting? This should kind of be a quiz, because I've mentioned a lot of these things, so I'm just reiterating some of these things also because they are super important. The reward should be after toileting is done. What if my child refuses? I mentioned earlier that it's important to identify what the reason is for the behavior. So why is it that the child is refusing? Are they refusing because they are anxious? Are they refusing because they are enjoying the toy that they're playing with? What is actually motivating that refusal behavior? And then once we identify that, then we can come up with a strategy to address that proactively, as I had mentioned before. How do I create consistency across settings? I really, really encourage you guys to use the handout that I made, because it does walk you through the steps that we went through the PowerPoint, in a packet, so that you can kind of come up with that creative plan that you can share with everyone. Okay. Now it's time for you guys to ask questions.
Hi, Lena. So Carmen would like to, she has, I'm just going to read her question.
Okay.
Can you hear me? My daughter used to go in her Mickey potty, but the minute she's on a regular toilet, she freaks out. We stopped because we figured she wasn't ready. She's also terrified of public bathrooms due to the dryers. Any tips?
Yes, so definitely your kiddo sounds like she gets anxious when things don't feel predictable or if she doesn't feel like she's stable on the toilet. So what I would say is it has to be a gradual process. So when you're doing toilet training, I would say really try hard to do the toilet training that you're doing and having her go as much as possible at home to start off with, so she builds confidence. If you're having her sit on the big potty, I would say really consider having a stool and an insert for the regular potty, and helping her to be a part of the decision about what she would like to choose. Because a lot of times there are, again, having control means that you're less anxious. I would also say that they actually make these, you can get them on Amazon. They are toilet inserts that are like, they fold into four, it's a circle that folds into kind of like four pieces. And it's easy to slip into a diaper bag or a bigger purse. And they make ones with Mickey Mouse on them. They make ones that, have princesses on them, make ones that don't have anything on them. And they actually have handles too, and they have a grip on the bottom of it. So basically you unfold it and put it onto a regular toilet, and then that, again, kind of creates some visual consistency too. So then you could use that even when you go to a public toilet. I mentioned the little sticky note on the automatic flush. With dryers, I would actually suggest doing the same thing. So making sure that when you walk in, you're aware of where things are and that you kind of take a different course there. And it might be that, you might even say, do some coaching beforehand and being able to say what she can do to avoid that. Sometimes, I don't know if your child has additional sensory issues, but sometimes even noise cancellation headphones can be something that can be helpful in reducing that distressing reaction.
Julie wants to know if you recommend boys sitting to pee. Her son goes in the urinal at school, has gone in the urinal at school one time and watches his brother who stands up, but I have a hard time making him stand there for too long.
Yeah, I mean, I would say that my preference is to always start out with teaching little boys to pee sitting down. I know that that's kind of like difficult to get everybody on board with, but the reason is because a lot of times cognitively it's difficult to then get the pooping part down if a child is standing to pee and they need to poop, and whether or not the child is then capable of thinking through and going, oh, I need to sit now. So I always, just for consistency purposes, start with sitting. Sometimes it can be helpful for kids to sit backwards on the toilet so that it's almost, it has kind of a similarity to standing up and facing the toilet, but still allows for the child to know that they can poop in the potty as well.
Albin says his child is 7 years old. He needs to be reminded all the time. How can we have him do it by himself?
So he is probably a kiddo who's going to remain on a timed voiding schedule for a longer period of time, as you had mentioned. What I would say is that if you think that you can pair using a potty watch with a motivator, so basically the two things that I would say is a potty watch to remind him when to go, and then to motivate him to go when the potty watch dings, you would use something called a token system. So at random intervals of time, you're just going to check and say, hey, are you dry? And if he hasn't had an accident, he gets a token or a little sticker. And then once he has like 4 stickers, he earns a bigger reward that he's selected. But the idea is that if you're doing that throughout the day, then you're motivating him in 2 ways to actually be more independent with going.
So Angie says, I need to make the window bigger, hold on. She's a 13-year-old, has tried much of what you spoke of. He meets the criteria for readiness and will go when we take him to the bathroom, both for pee and poop. I feel he falls feels that he doesn't understand the social impact, and the smell and feel doesn't bother him. Any other suggestions? He gets a cap full of Miralax at night. He will try to clean himself when told, but still I don't feel that he can feel he has to go.
Mm-hmm. So one thing that I would say is I would encourage use of a social story if you haven't already that talks about, especially if he is motivated by friendships, being able to kind of in a social story say, my friends don't like it when I smell or whatnot. Again, your kiddo may be somebody who, if he can't feel when he needs to go, may need to remain on a schedule for an extended period of time, or maybe even on an ongoing basis. And so the idea is not necessarily that we have to focus on getting your child to the point of being able to tell you that they need to go, but more so being able to respond and feel motivated by when they need to go on a schedule.
Sarah has a wonderful 4-year-old son with Down syndrome. She and Dad are divorced. Dad doesn't think his potty training has anything to do with his Down syndrome. Any suggestions for getting Dad on board?
And do you mean the challenges? I'm assuming I'm going to answer how I think that the question is framed. I think that a lot of times if we kind of stay focused on here are the challenges because my child has Down syndrome, you do feel a lot of pushback. And so what I would encourage you to do is, spend that time kind of coming up with what the plan's going to look like, and not necessarily saying, because he has tone issues, this is why we're doing the seat, the seat a certain way, but more so just saying, here's what our toilet training plan is going to be. Because my guess is that the motivation to have your child toilet trained at least is a common goal at some point.
Jessica says her daughter is 6 and has GI issues and has colitis and will have very runny diapers sometimes. We have been trying to toilet train for 3 years, but have had various setbacks because of medical issues. How can we get her continuously using the toilet? She will be good at using it, and then she will have it either a setback or episode of the colitis.
That's a really, really challenging question, because I think that it really is related to the medical piece and being able to address that first. It sounds like you're doing such a great job of really staying focused and addressing that. I think that, some of it is our kids, sometimes don't have awareness or sensitivity to pressure or pain. And so when you're talking about having runny stools, it's like kids who have the stomach flu and don't realize that that it's coming really quickly. And so, some of it is unfortunate that the medical piece is really impacting toilet training, because it sounds like she has really great periods of time when she's not having those issues. I would really revisit with the primary care doc or the pediatrician, the pediatrician or the specialist, and being able to say, are there other things that we can try as alternatives to address the colitis, so that toilet training can be more effective. But it sounds like you guys are doing what you can, given that there is a medical etiology that impacts when you have success and when you don't. It might also be that you're going to have to do a lot more timed sits, or even track when bowel movements are happening, and then anticipate those and have her sit ahead of time.
It's from Jackie. My son has dual diagnosis. He could care less if he's wet or soiled. He's 8 years old and has very few readiness characteristics. He used to sit on the toilet 2 years ago, but won't even sit now. He really has nothing that motivates him. Should I still start with him?
I would still start, and I would say that even if it's just sitting, even if it's just taking a step even farther back than sitting, it might be walking into the bathroom and washing hands and then going. For him, he might not have a ton of motivation, but if we can kind of think about a different strength, like being able to follow a routine or being kind of very focused on a routine, could that be the thing that helps a child to then make that shift as, oh, this is just what I do, and not necessarily that I need motivation to do it? And I'm going to interject real quick that if I, had time to sit and meet with all of you guys, I apologize if I'm not giving you a really detailed response. Some of that is, the limited information and me wanting to, give you an answer, but not necessarily knowing all the details. So I apologize if I'm not answering your question, but hopefully I'm giving you some guidance.
I'm going to try to figure out. The next question is from Liliana. She has a 5-year-old, and when she takes him to the potty, he will go, but he doesn't say he has to go. It seems like it's only a routine on the weekends, and we've been taking him to the toilet, but he rarely makes it. So what can we do to make him understand the importance of going potty?
So, and he, I'm sorry, can I get clarification? Does it say if he asks to go?
It just says take him.
It just says she takes him.
Okay. So when she takes, so I would actually say take a step back and actually do the data tracking if you haven't already. And the reason, again, that I do that is because if we are taking a child to the bathroom every 90 minutes, but they can only hold it for 60, then we're always going to be off on when their bladder is full enough to need to release and go. So it sounds like part of what you need to do is create more success or opportunities for success in order to then be able to go to help him understand when he needs to go.
Melissa says, my son is 3.5 years old, and when we notice him straining to poop, we put him on his little Mickey potty and applaud and cheer when he goes. I feel like the small potty gets him in a better position, but when would you suggest we transfer him to the toilet with an insert?
I would say that get him if he really is doing well and is successful on the little potty, I would actually encourage you to continue that until he has some consistency in going in the potty, whether it's pooping or peeing. And then, if it's a potty where you can take the top off and put it into the regular toilet, I would do that because, again, it's just much more concrete. Or, again, letting the child pick a potty seat that they want to have as a transition. But if you have a stool under their feet, a lot of times the transition's not, terribly difficult once they have established the routine of being able to push and knowing that that's what they need to do when they sit on the potty. So I wouldn't necessarily worry so much about when to do it. I would say, thinking broadly, if that's worked really well for now, then just get to, continue to do it until you have a point of consistency.
Okay. Kelly says, we are expecting our second child October 1st. Our daughter with Down syndrome will be 3 in October. I think that she has met many of the checks to start. Do you have timing recommendations when to start?
Yes. One is not when the baby's born. I think that would be an added stress in just being able to manage what the baby needs and when not. I mean, if she's showing most of the readiness signs, I would say if you feel like you have the capability right now to start doing some of the earlier precursor pieces, start doing those. Again, remember, when we talk about toilet training, we're not talking about having to have your child fully potty trained within a month. It's really about getting them to have little successes that build up to being able to be fully toilet trained. So I would say if you feel comfortable, start now and then continue after your, things have kind of gotten back into a routine after the baby's born.
Ashley would like to know if going without underwear for a specified time frame will help with muscle memory and potty training.
So I've had a lot of families who have actually said that they've had some success with not wearing anything and just letting their child go around the house naked, and then, or, without underwear on, and then, or a pull up, and then that kind of seems to make them hold it. Again, I think it really, really depends on each child. That's not a strategy that I would necessarily use, because the thing that I have to think about, given, all the kids that I've worked with, is what potential cognitive negative challenges might I come across. So I have one kiddo who the family used this strategy, and because he doesn't understand that home is the only place he can be, without a pull-up or without underwear or anything, he actually sometimes disrobes in public. And so by doing a strategy, we kind of created a second problem. So I don't necessarily recommend it, but I think that if you feel like you can help your child understand that clothes have to stay on in other settings, then, I wouldn't necessarily say you shouldn't do it.
Jill says, my 6-year-old daughter was frightened by the sound of her pee in the toilet the very first time she did it. It has been 2 years since then, and she still refuses to pee in the toilet, although she is happy to sit on it, wipe, flush, wash hands, and everything else involved. How can we get past her fear? Oops.
That's a really great question. You guys are throwing some really difficult ones out at me. One thing that I would suggest is you can get, like the little inserts that catch urine for when you have to get a urine sample from a child. I would suggest using something like that to make it so that the sound is not so alarming. It is going to mean that she's going to have to actually try to produce something at least once in that type of a potty. But again, as I suggested to somebody earlier, you might consider noise cancellation headphones, or even headphones with that play music if she's motivated by music, so that she's not actually listening to the urine coming out. And that actually, music might actually make her relax enough to go too.
Kate says, my 2-year-old without Down syndrome is showing interest and pees in the toilet. His 5-year-old brother with Down syndrome is not interested, but feels bad when his brother gets a reward. Do I encourage Big Brother to try even though he seems conflicted, or do I just focus on the 2-year-old and come back to older brother in a few months?
If he's feeling conflicted, it might be related to the fact that he doesn't feel competent in being able to do it. So again, I wouldn't say that you have to avoid it completely. I would say set a smaller goal, like have him, reward him for sitting on the toilet, and then once he's consistently doing that, then reward him for producing something in the toilet, and so on and so forth. So, there are so many things you could be doing, already that are still kind of in line with not stressing the situation, like even data tracking to see how long your child with Down syndrome can hold it. Those are all preparatory skills so that you can, kind of keep motivation strong. Because the thing that you don't want is if your 5-year-old is feeling defeated, for him to give up before he's even tried.
Kelly would like to know, are pull-ups the recommended diaper to use instead of regular diapers?
It really depends on what your preference is. I know pull-ups can tend to be more expensive than diapers. Some families will use diapers but just Velcro it a little bit looser so that it kind of serves like a pull-up. I think that, that to me that you could use either, as long as the idea is that the child can pull them up and push them down on their own if they have the motor skills to do it. I always say, if you do have to do a cleanup, you also don't want them to lay down to have to take it off like a regular diaper, because then you're also not creating the association around now we're transitioning to the potty. So that's partly why I like pull-ups better, but I also, feel appreciative of the financial burden that can sometimes have.
Catherine says, I have been training my daughter since 3 years old, and she's 8 years old now and still not able to tell when pee is coming. Do you know if there's been if there's just been if it's just Down syndrome? I'm sorry, the question's not very clear. Do you know if it's just Down syndrome or if she's going to be potty training forever?
Um, without knowing your child specifically, I can't say what the case is. We do know that for some children, and I would actually say in my experience, a lot of kids with Down syndrome are not hypersensitive to things like pain or being able to identify that they're in pain. I have so many kids who have like raging ear infections, and they behaviorally will tell me that something doesn't feel right, but aren't able to actually identify where on their body hurts. And to me, toileting is a similar issue in that sometimes they're not necessarily feeling it, and sometimes they aren't paying attention to it because whatever's in front of them is more motivating. So, what I would tell you is I don't think it's just Down syndrome, but I also think that you might have to do similar to what I shared with some other folks in your child might remain on a timed schedule where you're not necessarily prompting them, but a timer or something else is prompting them paired with something that's motivating to actually go.
Is it okay to use food as rewards?
I'm not a fan of using food as a reward unless it's like a last resort. I have a couple of kiddos who are really not motivated by anything. Some of my kiddos who are dually diagnosed don't have a ton of motivators. I really don't like to use it as a reward for two reasons. One is because I don't want them to think that every time they do something that they get food. And number two is that we know that children with Down syndrome, their metabolism slows down significantly more than a typical person's metabolism. So we a lot of times deal with weight issues. And for a lot of our kids, from the cognitive standpoint too, they end up feeling super motivated by food as a pastime or something to do. And the more that we use it in association to things that are not just about sustenance, I feel like that kind of creates a bigger issue. So that's more my personal bias, but I think that there's lots of things that can be motivating. So I also don't think that it's always electronics. I think sometimes it's an activity with an adult or a social interaction or getting to pick, what they have for dinner or things like that. So I really like to save it as a last resort.
Okay. Should you ever scold your child for having an accident?
No. No. I think again that creates a negative association to the toileting process. I think that it is really, really hard to do because as parents and as caregivers, we are human. So, our frustrations do show. I don't think that our kids really understand that having an accident means that you're in trouble or what they did wrong. And so I feel like scolding is more about us needing to kind of get rid of our frustrations and less about the child understanding that they shouldn't do it again.
Okay. Albin says, our child is wearing diapers at night. Besides not giving water before bedtime and waking him up at midnight, what else can we do to encourage him to go?
A lot of times for nighttime, I would say that it's pretty complex. For some kids, they are such deep sleepers that it is really difficult to get them to wake up when they need to go. And because of some kids having more complicated medical issues like sleep apnea, it might involve like taking equipment off and things like that. So, again, without knowing your child, I can't give you like a detailed specific answer. But one thing that I will tell you is that if it's a matter of like your child being a deep sleeper and only waking up to go when you wake him up, I would say there is something called a potty alarm, which basically clips on to a pull-up and basically it sounds an alarm when a child starts to go and kind of causes them to constrict to wake up and actually go on their own. So, that's not something that everybody has to resort to, but if it is about being a deep sleeper, that might be something as an alternative to a parent waking them up.
And our last question is it bad to switch back and forth between pull-ups and underwear?
I again I'm a fan of being consistent, so I would say, you'll know when to transition to underwear when a child has been consistently dry in their pull-up. And if they're motivated by wearing underwear, by all means, that's fine. Some people will say that they it's not going to necessarily cause harm, to switch back and forth, because I know some people will say, well, they're dry consistently when they're at home because I take them on a schedule, but at school they they won't because the school can't take them on a regular schedule, so they do a pull-up. I think it slows down the toilet training process to switch back and forth, but I don't think that it's going to cause any significant harm.
Okay. That was our last question.
Wonderful. Thank you guys so much for spending time with me this evening. I really appreciate it. You guys gave me an opportunity to talk about something that I love to talk about, and I hope that I was able to provide you with some additional ideas or tips on how to kind of approach toilet training.
Okay. Well, thank you so much for your time tonight, Lena. We really appreciate it, and I hope that everybody is going to be able to go forth with some positive potty training tips.